Hello, thanks for being here today. I'm Jen Harris from Montgomery County, and of course, joining us is Dr. Bissell. She's going to be talking with us a little bit about COVID-19 in our community. And if you have any questions while we're here today, please ask them using the chat or the Q&A. Thank you for being here, Dr. Bissell.
Thank you, Jen. Thank you all for joining us. We're going to go ahead and do an update today, and then next week we'll plan to be our last update unless something otherwise changes. But our epi curves, which will be posted on our Road to Wellness website, show that our cases continue to drop pretty significantly. So the curve has kind of followed what we expected to happen with Omicron. We're making that transition. It's coming actually at a good time as the weather is improving. Hopefully people will take advantage of spring and summer weather and spend more times outdoor where the ventilation couldn't be any better. And hopefully people who are eligible have gotten their vaccine, have gotten boosted. Hopefully those who have had COVID are getting along. And we're shifting. Just by making this transition doesn't mean that, by any means we're discounting COVID and what it has put everyone through for the past couple of years, but we're sort of learning that dance with COVID and doing those individual risk assessments, our individual risk tolerance, remembering that there is no zero risk, nothing is zero risk. And then, again, as we shift to that individual masking for protection. So that's really all I had, and I'll just take whatever questions.
Okay, our first question coming in from Eric. How big of a threat to the U.S. is the BA.2 variant that is spreading in Europe?
So, obviously, we'll continue to monitor for the BA.2 variant. And yes, we have the BA.2 variant here. There are areas in the Northeast and certain areas out west that it's becoming a larger percentage of the samples that they are sequencing. Yes, it is more transmissible. The data does not show that it's any more virulent or dangerous, or that the vaccines lose any of the efficacy against hospitalization, severe illness, hospitalization, and death. So, so that's all good things. We have to get into that surveillance mode where we do follow things. And again, we're not discounting that COVID is still here. We're just approaching it that we have the tools, we have the vaccine, we know what the best ways to prevent it are. And then we do have more therapeutic options as well with monoclonal antibodies and the antiviral pills, and we do expect that those will continue to improve as well. So far, the data that I've seen, there's a couple of differences. Obviously, in the United States, we worry about comorbidities, putting people at higher risk, and certainly, hopefully, those who have those comorbidities are those who've been vaccinated, who've gotten boosted, or have had COVID and have had some combination thereof. The data from Europe showed that kind of when the BA.2 variant got to be about 60% of their samples is when they started to see the cases increase significantly. There are some areas here in the United States that have already gotten very close to that or approaching that, and they're not seeing that at this point. We'll continue to watch. The data from Europe, hospitalizations, they've seen hospitalizations going up, but again, you have to get into looking at, are they being hospitalized for COVID or with COVID? Because there is a good percentage of them that are being hospitalized with COVID as an incidental finding versus for COVID. So those are all things to watch for, and obviously when you see a lot of cases, you'll see proportionally more hospitalizations, and you may see the deaths. But again, those deaths are in those older patients and those patients with comorbidities. So not showing us anything that's unexpected. One of the differences I think to bear in mind is that Europe kind of shifted to the BA.2 variant faster than the United States did. So they didn't really have a full-blown surge like the United States did with the BA.1 variant. we have every reason to expect that those who've had the BA.1 variant have some protection and some recent protection. And again, that the vaccines are as effective. So, we'll watch it very closely. It doesn't change that we recommend that people get vaccinated, that people who are eligible, and certainly those with comorbidities, get boosted. And it doesn't change that, we know how COVID is spread. So outdoors, obviously with the weather improving, is the best for any kind of social activities, doing those risk assessments, doing the risk tolerance. There is no guarantee with anything, but just like with flu, just like with other communicable diseases, we know that there are certain risks involved, and we have to look at that. So we may see, right now, I think what we're expecting is we may see bumps in our cases, but we are certainly not expecting to see the surges like we saw with the BA.1 variant from the data that we're seeing right now. But we are watching it very closely, and that's the whole point of surveillance, is to watch for this variant and to watch for any other future variants. When we accept that COVID's not going away, that means that we have to be really attentive with the surveillance to follow up and see what else is out there. And again, as we've said, there's still a substantial portion of the world that is not vaccinated. And so we do expect that the virus will continue to mutate, and we'll see these other variants.
Okay, Alexis is asking, are you concerned about people returning from spring break and seeing a potential spike in COVID cases?
No, not really. Our two major universities had their spring breaks last week. So this is their, and actually not last week, the week before. So the first week of March. And we've continued to see our cases go down. We have not seen a big spike in cases after they got back. So, I think pretty much across the country right now, as you can see from the latest CDC maps, transmission is dropping across the country. Now, certainly if someone comes back from places in Europe, then we might see some cases there, but we haven't seen any big spikes related to spring travel so far.
Okay, Jean is asking, a new report claims that J&J protects better against breakthrough cases than Pfizer and Moderna vaccines. One theory going around is that after the first few months, the protection of other vaccines harms the body's natural resistance to COVID. Do you have any thoughts on this?
I wouldn't say so much harms the body's natural resistance. I think, again, what we're looking at is, there's the two different types of immunity. There's the antibody response, there's neutralizing antibodies, and then there's the cellular response, which is the immunologic memory. And Paul Offit, who's a really just an outstanding vaccinologist, immunologist, he actually wrote an editorial about it and, what our expectations are. So preventing any disease at all costs is what you're looking at, that neutralizing antibody. And that's why as those neutralizing antibodies go down, people encourage the boosters to try and pump those up some, because that's what's going to prevent infection and mild disease. It's the cellular response that takes a little bit longer to kick in. So, it's that immunologic memory, it takes a little bit longer to kick in, but so it might not prevent mild disease, but it's really good at preventing that severe disease, hospitalization, and death. And, to us, that's the big success. Obviously it would be great if we could totally prevent transmission, but, the biggest success is when we can prevent the really bad outcomes from it. As far as harming the body's immunologic response, we just don't know at this point. I think we just have to follow, and I think this difference now shows us that we really have to look beyond just those neutralizing antibodies, and we have to look at that immunologic memory and that cellular immunity in, when we're evaluating how effective those vaccines are. It's not all just related to that neutralizing antibody response. And, the body is an incredible machine. And we do have, really good precedent where the body's immunologic memory is pretty amazing. So we don't want to discount that just because those neutralizing antibodies drop off. The reality is that the body is exposed to antigens like COVID all the time, and it simply cannot keep those antibodies around for everything it's exposed to. The blood would be really, really thick and sludgy if it did that. So we have to rely on the body to have that memory that when it's challenged with that antigen again, so when it's challenged with COVID again, it can kind of ramp up its response, and that's that cellular immunity. So I think we'll continue to follow it. And I think this just points out that we still have a lot to learn, but we can't just count on those neutralizing antibodies, which I know is what they were looking for in those vaccine trials.
Well, that appears to be the only or the last question we have in the queue for today. So we appreciate your time. And again, for those of you who might have missed the first minute or two, this is we're planning to get together again on Monday the 27th. Is that right? That's the date. And then beyond, the 28th, Monday the 28th, sorry. And beyond that, we'll see what happens, but potentially our last time together for this type of a call will be on Monday, March 28th. So thank you again for your time, and we look forward to next week.
Thank you, everyone. Thank you, Jen. Have a great week. Enjoy some good weather.
You too. Thanks. Bye-bye.